So if you look at emergency departments in Winnipeg, they're very, very busy places. So every year there's about 250,000 visits to one of the 6 adult sites in Winnipeg. And to put that in perspective, that means that every day there are about 5,000 hours of ER care every day in Winnipeg, which is an astounding number. However, when you start to look at what types of visits they are, every ER visit is triaged by a nurse. And when you go into ER, you're given one of 5 categories. 1 being the most urgent, and then 4 and 5 being the least urgent. And so yes, there's 250,000 visits. However, 40% of those visits are the lowest acuity visits. So these are individuals with more than bumps and bruises, but sprains and simple fractures, those types of things, sore throats, et cetera, et cetera. The other thing to look at how busy ERs are 1 in 10 of those visits, the patient actually doesn't finish the visit before he or she leaves. So they come to the ER and they either leave the ER without seeing a physician, or they leave before the physician says, it's time to go on with him. So out of that comes this whole process of, well, yes, ERs are busy, but it allows you to ask this question, are they busy with the right type of person? It's tough to define a typical ER visit. So if you look at an ER visit at the population perspective, you can say things like, well, about 15% of the time people will arrive at an ER by ambulance. About 12% of the time people will go into a hospital after an ambulance. And about every other visit has some type of diagnostic test, like an X-ray, a CT scan, blood work, those types of things. The most important purpose of this research is to really get at ER wait times, and specifically waiting room times. So, and to really try and understand what are the factors that drive wait times or make them longer. Is it volumes of people? Is it hospital factors? Or is it ER factors? And again, we're showing that it's primarily ER factors, a little bit of the hospital factors, and not so much of the input factors, especially if you're a sick person. So if I show up at an ER and there's lots of people needing diagnostic tests, that's what makes me wait longer in an ER, not so much the hospital beds. The hospital bed stuff is important, but not as much as the diagnostic testing. The other thing that we find in all of this is just sheer volumes of people, noses through the door, if you will. That in and of itself does not have a huge influence on how long I would wait to get into an ER. It's especially the case if those people there ahead of me are lower acuity. If I show up at an ER and I'm sick and I need care quickly, I will get it. Higher volumes of lower acuity people don't impact how long I wait to get care. If I'm a less sick person, i.e. if I have a sore throat, severe bruises, those types of things, and there's lots of other people like me around me, yes, then I may wait a little bit longer. So it's a little bit of an if-then discussion. The good news behind all this is we're able to say, if you want to have an influence or help to reduce ER wait times, there's really 2 things you can do. There's things that can happen in the ER as it relates to diagnostic tests, and there are some things that relate to the output stuff, the hospital-related factors. But again, it's the throughput factors that are most important.